Welcome to DermWire News, powered by DermWire.com. DermWire News for Smart Speaker is made possible with advertising support from Ortho Dermatologics. I'm Stephanie Talea with Practical Dermatology magazine. The FDA approved poteligeo or mogamulizumab KPKC injection for intravenous use for the treatment of adult patients with two types of cutaneous T-cell lymphoma, relapsed or refractory mycosis fungoides or Sézary syndrome, after at least one prior systemic therapy. This approval provides a new treatment option for patients with MF and is the first FDA approval of a drug specifically for SS. Mycosis fungoides and Sézary syndrome are rare, hard-to-treat types of non-Hodgkin lymphoma, and this approval fills an unmet medical need for these patients. We are committed to continuing to expedite the development and review of this type of targeted therapy that offers meaningful treatments for patients, says Dr. Richard Pazdur, Director of the FDA's Oncology Center of Excellence and Acting Director of the Office of Hematology and Oncology Products in the FDA's Center for Drug Evaluation and Research. The approval was based on a clinical trial of 372 patients with relapsed MF or SS who received either poteligeo or a type of chemotherapy called vorinostat. Progression-free survival was longer for patients taking poteligeo, median 7.6 months, compared to patients taking the chemotherapy drug, median 3.1 months. The Antimicrobials Drug Advisory Committee of the FDA voted in favor of the approval of intravenous and oral omadacycline for the treatment of acute bacterial skin and skin structure infections and community-acquired bacterial pneumonia. Paratech Pharmaceutical Incorporated's omadacycline is a modernized tetracycline being developed as a once-daily IV and oral broad-spectrum antibiotic for the treatment of serious community-acquired infections. As part of its recommendation, the advisory committee considered data from the omadacycline Global Development Program, which included 3 completed Phase 3 studies evaluating the safety and efficacy of the once-daily IV and oral formulations of omadacycline for the treatment of ABSSSI and CABP. In all 3 studies, omadacycline met all primary and secondary efficacy outcomes designated by the FDA and was generally safe and well tolerated. A total of nearly 2,000 adult patients received omadacycline administered once daily as part of the clinical trials. The advisory committee was asked to vote on whether the data provided substantial evidence of the safety and effectiveness of omadacycline in both ABSSSI and CABP. The Prescription Drug User Fee Act date for both new drug applications is in early October 2018. Thank you for listening to DermWire News, powered by DermWire.com. This editorially independent program is supported with advertising from Ortho Dermatologics.